Hello, my dear friends. Welcome back. Welcome back to our lesson for you, friends. We had a long gap because of some issues that I was having. You know that we are discussing about the muscles of the lower limbs, right? So, in that, we have already covered, we have divided the regions of the lower limb in which we will discuss the muscles, the gluteal region, the thigh region, the leg region, foot region, right? You know, in our previous lectures, we had discussed about muscles of gluteal region, the gluteus maximus, gluteus medius, gluteus minimus, obturator internus piriformis muscle, quadratus femoris muscle, superior gemini, inferior gemellus, right? These were the muscles of your gluteal region. I hope you have watched those lectures and I hope you have learned something from all those lectures. Now let us go towards the thigh region, right? So from the region, the gluteal region, below that starts the thigh region, right? So the muscles of the thigh region, we know that our thigh region is divided into three compartments, right? And what are those? Look here. This is the anterior compartment, right? If you follow the cursor, this is anterior compartment. This is posterior compartment. And this compartment is medial compartment, right? So anterior compartment, medial compartment, and posterior compartment. Done. We will discuss the muscles in these three compartments, right? So let's go for it. First of all, the muscles of anterior compartment, which we show the anterior when we are standing in anatomical position and we are showing the interior of our thigh. So here are some muscles. So the muscles of the anterior compartment of the thigh region, the first muscle that you have is Sartorius muscle. The first muscle is Sartorius muscle, this one, right? It's a strap-like muscle, it's a snake-like muscle. Sartorius means snake-like muscle, right? Let's go for it. It's the muscle of thigh region. The Sartorius muscle is the longest muscle in the human body. The longest muscle in the human body. It has got a transverse section in shape of the triangle. In transverse section, it shows a triangular shape with a base upturned, right? And it is strap-like muscle, right? Lengthwise, if you see, it's strap-like muscle. Where is it located? The Sartorius muscle is a thin, long, superficial muscle in the anterior compartment of your thigh. So Sartorius muscle is located in the interior compartment of your thigh region. Right. Where does it get its origin? It arises from the superior iliac spine, anterior superior iliac spine. You know, in the iliac bone you have spines, anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine. All these spines are there. So it gets its origin from the anterior superior iliac spine and it inserts into the proximal end of the tibia below the medial condyle, right? It inserts into the proximal end of the tibia, right? In the medial, below the medial condyle. So this is medial condyle, this is lateral condyle, and this is the region below the medial condyle. What are its actions, right? So its actions are divided into different regions of your thigh. First of all, in the hip region. In the hip region, what it will do there? It will cause the thigh flexion, the thigh abduction, the thigh external rotation. So look, whenever this muscle will contract, it will cause the thigh flexion, it will cause the thigh abduction, right? And it also causes the thigh external rotation. At the knee joint, it causes the leg flexion, right? And it also helps in the leg internal rotation. Look, whenever this muscle will contract, your leg will move inward, so inner or internal rotation, right? So these were the actions. What are the actions? Thigh flexion, thigh abduction, thigh external rotation, leg flexion, leg internal rotation. What is its nerve supply? The Sartorius muscle is supplied by femoral nerve, which comes from the branches of L2 and L3, femoral nerve. And its blood supply, according to blood supply, it is divided into three regions, right? The proximal third, middle third, and distal third. The proximal third is supplied by femoral artery, deep femoral artery, anterior quadricep, and lateral circumflex arteries, femoral artery. All these branches are coming from femoral artery, right? Middle third is branches of femoral artery, distal third branches of femoral and descending genicular arteries. So, okay, all these are the branches of the femoral artery. So, friends, this was about the Sartorius muscle. In the next lecture, we will discuss about another muscle.